Well, Dr. Barb, how are you today? I'm so excited to have you on the show.
I am great, and thank you so much for inviting me. I am looking forward to doing this.
Awesome. So today we're going to talk about magnesium, which is a heavily misunderstood mineral. And so I'm hoping that you can kind of shine some light on it because there's like a million different types of magnesium, some that are essential and that you need, and others that are more of a marketing type of deal, things like that. I'm sure you're going to clear the water on all of that with us today. But before we dive into that, can you tell my listeners a little bit about yourself?
Yeah, so I am a licensed naturopathic doctor. I practice in Toronto, Ontario. So, in clinical practice, I use magnesium a lot because I deal with hormones and inflammation. We do a lot of stress management, and all of those areas are usually involved in magnesium deficiencies, and it's just a perfect fit. So, that is basically what I do. Full time. And then I obviously have the word out on Instagram, as my account is probably 80% all about magnesium. So, yeah.
I love that. I think I heard you on a podcast and I was like, okay, this lady is the best out of everybody I listen to about talking about it and breaking it down into what are the different forms and what they are beneficial for. And I was like, okay, I got to get her on here because there's so much confusion. It comes up in conversation a lot. And so I'm hoping you can help my listeners understand it a little better.
Absolutely.
So just before we get started, if my listeners aren't driving, it'd be great if they grabbed a pen and paper because this is a big subject to unpack as well. So, yeah. Anyways, so let's get started with magnesium and how it works in the body and why it's important.
Okay. So, yeah, I think it's not even just that magnesium is, um, misunderstood. I think magnesium's just underused. So we don't hear a lot about it. We don't really talk about it much. I know that when I went to medical school, we didn't talk about magnesium. It wasn't something that was taught. It wasn't something that was brought forth. So when I finally started doing some of the research and I was using it in practice, I finally understood how important this mineral was in our body. So magnesium, it performs over 600 enzymatic reactions in our body. And what that means in plain English is that it has its hand in almost everything. So whether it's digestion or stress reduction or hormone production or vitamin D activation, thyroid, I mean, any part of the body, it's kind of got its hand in there. And obviously it's part of our electrolyte system. So, but what we normally hear about is sodium and potassium, and we kind of forget about magnesium. And so now they're starting to come out with more and more research how they're able to use magnesium. And I think the other thing we have to understand is we're all very deficient in this mineral, and it's really easy to become deficient. So a lot of the symptoms from deficiency actually are part of other illnesses, and so it's often not thought of, and so you're labeled with, insomnia, and you've got this diagnosis, but they really haven't addressed the underlying root cause. So yeah.
So, can you tell us some of the things that help us become deficient in it? Because there are some things that contribute to that, correct?
Yes, there's lots of things actually. So magnesium deficiency, obviously, if we start from food, which is where we would be getting magnesium, our foods and our soils are also depleted now, that we're not getting the same amount of magnesium that we were getting in our food 10, even 15 years ago. So we're not getting enough just in food alone. So there's already the first step in deficiency. But if we're stressed, we're going through our magnesium much quicker. If we consume sugar, it takes 54 molecules of magnesium to process one molecule of sugar. So if you are a sugar addict, you're blowing through your stores quite quickly. And we also have things like digestion. So if your digestive system is off, you're being depleted in magnesium. Certain foods have tannins in them, and they deplete magnesium, and something like tea, for instance. So if you drink a lot of tea, you could just by the tannins alone be losing that magnesium. There's also chemicals and toxins and fluoride that will deplete magnesium. So there's many, many different areas, and I have yet to test someone who was not deficient. So, and I don't see everybody in the world, so that kind of gives you like a general idea of, you know, we're not getting enough, and it's hard to get it from our food. I always promote food and I'd like as a first step, but you know, supplementation is sometimes absolutely necessary. Yeah.
Awesome. So this is where it kind of gets confusing though, because when you go to the health food store or the supplement store or wherever you get your supplements, you look on the shelf and there is a whole row of different kinds of magnesium. So like, where do you start? I mean, there's magnesium citrate. People take it before bed or to relax. There's other magnesiums as well. And if you're just like, okay, well, where do I start? If I'm taking one, I must be good, right?
Well, you would think that, and not really so easily put. So yes, you're going to see a lot of magnesium supplements and different forms. So I like to keep it. There's usually 4 forms that are really specific that we use and have a lot of research. There's some less expensive forms that I really do not want people to take, or you really have to read the ingredients. So magnesium oxide, for instance, is a very inexpensive form of magnesium that they like to put into magnesium supplements and sell. Unfortunately, we don't absorb that. So you are just not going to absorb anything when it comes to oxide. And there are actual supplements out there that are just magnesium oxide. And the other way that they like to do that is mix them into complexes. So they'll have a complex and it'll be bisglycinate, oxide, citrate. The problem there is they don't tell you how much of that complex is oxide. So it could be mostly oxide and they have a little bit of bisglycinate and citrate in there, but you're still not getting the benefits. So my advice right off the bat is just always look at the ingredients. If you see oxide in there, besides the chelated and buffered forms, because they do mix it with a little bit of oxide to promote more elemental magnesium. But you'll see that the main component is bisglycinate. Then I just would not take that product. I would look for a product that has specifically, you know, what you're looking for. So when we're looking at the forms, if we want to start with citrate, for instance, so citrate is basically constipation digestion. And I know a lot of people use it for sleep, but it's really not meant for sleep. It's just what they kind of had put out in the Calm formula, and you know, and then people were complaining that they were getting digestive upsets, or they were getting like, it was like a laxative, right? Depending upon how much you took. So citrate we reserve for if you're having constipation issues, or you're having acid reflux, or you're having some digestive issues. That's when I would implement citrate. Bisglycinate, I would definitely look at for sleep. Anything that needs calming, because it has the amino acid glycine. So glycine is very calming to the nervous system. And that I would use as more of an all-around general magnesium. So if you wanted something that kind of touched on a lot of, excuse me, a lot of different components, that would be the magnesium that I would choose. But it's very good for sleep and stress.
The bisglycinate is.
Yes. Now, mind you, some companies call it glycinate and some call it bisglycinate. It's the exact same form.
That's very good to know. So can
Yeah.
you tell me then, for all of these people that take the Calm supplement or the magnesium citrate, is it just a placebo effect that you happen to sleep well also, or happen to, I don't know, I feel that there is a calming effect to it. I take it myself. Is that like a placebo effect, or is there actually something to that?
You're probably still getting a little bit of the magnesium that is from citrate, because citrate is fairly absorbable. There's no doubt you're likely getting something. It's just you're not getting the whole molecule. And
Mm-hmm.
that molecule is the way that it works, and the way that citric acid works, which is what citrate is it goes through the digestive system. So yes, you're probably getting a small effect, and then there may even be a placebo effect because you are getting an effect to begin with. But if you take bisglycinate, and you compare them, it's a little bit of a difference. You'll notice the difference more so in nervous system, like just a calming. A lot of people explain it as like they're floating on clouds because it just shuts down the nervous system, right? Like it just relaxes it.
And then can you tell me also why the magnesium citrate has such good digestive properties, or what helps you to digest better when you are taking it? I know personally myself in the end stages of contest prep, I used to be a bodybuilder. I had a very hard time digesting my food because I was so lean. And so I would take that every night, and it improved my digestion amazingly. And so I'm wondering what it is that helps that process along in the magnesium citrate.
Without getting into a huge biochemical like explanation, because I'm sure nobody wants to hear that, it's the citric acid. So the citric acid cycle is a cycle. It's kind of like, if I were to compare it like a Krebs cycle, that cycle is happening in our body, and it happens mainly through a digestive process, and that is what citrate is made up of. And so that is why we get those digestive components. And it's also like, especially in the form of constipation, it's allowing that water to come into the intestines. And that's what citric acid does. And so that's why it has such a big function for digestion. It's simply the molecule that it's made with and that it's combined with. But it sure will have, like, I mean, prior to bisglycinate, citrate was the magnesium of choice, right? Like this is what was out there. And so it got like, okay, we're going to use it for stress, and we're going to use it for sleep, and we're going to use it for digestion and all of that. And the problem with that was that a lot of people ended up getting laxative effects because that water coming into the intestinal tract happens regardless, right? So it's not something you can just stop. So if you have to take 400 or 600 milligrams, that might produce a laxative effect.
And for some people, they don't need that help. So what are some other things to look for as far as a quality magnesium supplement goes?
So what you want to look for is like legitimately that it's just the magnesium form that you're looking for is in there. I cannot get over how many times I look at a supplement and I'm like, okay, why do we have coloring in here? Or why do we have an artificial flavor? Or why do we have a natural flavor? And I know that in the powdered forms, you will find that at times because they're trying to make it palatable so that people take it. But I've seen this in capsule forms, which is just blows my mind. I mean, I have even seen aluminum.
Mm-hmm.
So we really need to look at the ingredients. Make sure that of course, you're going to have whatever the capsule is made out of. And if they're like vegetarian or they're gel capsules, they're going to have the same ingredients. But we really want to look for the other things that they're putting in there when it comes to like the forms. And you'll find it most often in the complexes, more so than in the straight format of like citrate or bisglycinate.
All right. So that kind of leads me thinking to another thing here. When you're consuming electrolytes, oftentimes magnesium is an ingredient in there. I don't know that it always says what type. Are you consuming something that's not doing you any good in the first place? Or what's a way to kind of decide what is going to help you and not be just a wasted mineral thrown in your supplement?
If it's in an electrolyte format, or even if you're doing like a colonoscopy prep, these magnesiums that are being used in there are usually like a carbonate. Are they absorbable? It's better than oxide. It's
Mm-hmm.
not as great as citrate or bisglycinate or malate, but it is a little better than oxide. And so it's just, because they're bound with other electrolytes, you'll likely absorb them a little better than if you were to just take a carbonate on its own. And then obviously when you do something like a colonoscopy prep, it's in large doses so that it acts as a laxative, right? So yeah.
So if you walk into the supplement store, the number one magnesium supplement you need to look for is the bisglycinate. Should that be combined with another form of magnesium, or is it okay on its own?
If you're just looking for a general, I like to just go look for it on its own. And even in patients, if they do have a constipation issue, I will put them on citrate separately, and then give them the bisglycinate during the day. And I usually will dose that citrate at night so that it's kind of working while they're sleeping, and then, you know, they're able to have that bowel movement in the morning, for instance. And then during the day, I'll put them on a bisglycinate, just because I know that the absorption is much better and will improve things along the line. But then let's say malate is another form that I use, and I use it a lot with fibromyalgia patients, because malate is a lot for muscles, bones, joints, tendons. So if you have a condition where, you know, you've got chronic pain and joint tenderness and joint pain and just muscle pain, that is a really great form of magnesium for that. And so when I dose that, I will dose it separately from the bisglycinate. So because it's a very it just kind of helps with that kind of situation. So I don't use it for much else.
So going back to that, you were saying it's really good for muscles and tendons and things like that. So how about athletes and people that are placing a lot of burden on their body?
Absolutely.
Would that be something that would be beneficial for an athlete or someone that's having to constantly recover from something?
Yes. Yeah. So that's it. This form of magnesium is specifically for that type of anything to do with bones, muscles, joints, tendons, all of that stuff. Yeah. Yeah. So I would definitely, like even if I know that if I've over exercised or something and then I take malate the next day or even that night, my recovery is much better. It's quite quick. It's quite quick.
So do you have an easy way to describe why that improves your recovery?
Well, again, it's based upon the form that is attached to that magnesium, which is malic acid. And that is all involved in the bones and the joints and the biochemical reactions that happen. So it triggers kind of like that area of the body. And so, of course, we'll give you benefits in that area. Yeah.
I'm sure there's some large biological thing you could break it down into, but I was just curious because it's interesting how different things work to help repair things or help with protein synthesis, you know, all of that stuff.
Right.
So that's why I was curious if there was a simple answer for that.
Yeah. So unfortunately, because magnesium is involved in so many reactions, it's mostly from a biochemical perspective, because it either activates, deactivates, increases, decreases enzymes and reactions based upon what it's tied with. So that's how most of the different forms of magnesium work too. Yeah.
I love that. Are there any other kinds that somebody could expect to see or hear about that may affect them in some way?
Yeah, so the other two big ones that I use are taurate. Magnesium taurate is specifically for heart. So any cardiovascular. So if they've got high blood pressure or angina or cardiovascular disease or any type of cardiovascular issue, I like to use that. It's a very calming, and you sometimes even see citrate with taurate. And it's kind of like, it just helps the muscle of the heart out. It helps a lot. Like taurine is good for the heart to begin with. So I like using that for that very specific reason. And then the other one I like to use and have been using a lot is L-threonate. So this is a magnesium that it's the only magnesium that crosses the blood-brain barrier. And so I use it a lot for concussions, brain injuries, anxiety, mood-related, depression, those kinds of things. Anything to do cognitively, like memory, cognitive decline. That magnesium is really, really effective because it can actually get to where it needs to get to do what it needs to do. And so that is a fairly new supplement, probably in the last 2-3 years. So I know that in certain areas they haven't got them and you got to order it online, but here in Canada, we do have access to them. So I use it quite frequently. Yeah. Yeah.
Awesome. So, I mean, there's a lot of things with sugar and magnesium, and you kind of touched on that a little. And we live in a primarily carbohydrate driven society. And so just because somebody doesn't eat candy all day long, they're still eating breads and pastas and pizza and oatmeal and all these things. And it's become kind of a hot topic in the magnesium area too, because you are depleting so much of it trying to make up for that sugar.
Right. And a lot of people don't understand that. So, and it's actually one of the biggest forms of magnesium deficiency that we see. So if you are living a high carbohydrate kind of diet lifestyle, and or you have a lot of sweets in your diet, you're going to be using up that magnesium, and then you're not going to have it available, because as you're using it, your body needs it for so many things, but then you're also depleting it, so now you're even further depleted. And this is usually what happens when we measure the levels. We see the depletion is so great that when we actually get them to just like bare minimum normal, they see huge improvements, because things can start to happen again. And I think a lot of people don't realize that, those carbohydrates that break down into sugar, or that sugar that you're eating, is actually probably causing a lot of your symptoms, because there's symptoms that are associated with other things, right? Like joint pain, and, having sleep difficulties, and having, a racing heart, or all of these things can be attributed to other illnesses. And so a lot of the times it's just not even looked at that magnesium could be the underlying potential that is not happening, and that we should be looking at, rather than doing all of these things. I had a patient a couple of weeks ago who came in with an arrhythmia, and her cardiologist was like, well, we can go put you on this medication. It was a beta blocker, and we can do all these things. And she went on the beta blocker, and she felt horrible and tired, and I was like, I'm just going to put her on magnesium and see what happens. And she had taken herself off of the beta blocker, not on my advice, but she just didn't want to feel like crap. And within 3 days, she went down to having they measure these arrhythmias in per minute. So she was having 40 to 45 per minute. She went down to 10 to 12 in 3 days.
Wow.
So she was so deficient, and we didn't get her blood work back until, a few days after that. So, and we could tell she was severely deficient. She was way below normal. And so that was really what the issue was. And she improved so much in just 3 days. It was just fabulous. I just couldn't get over that. I was like, wow. So, yeah.
Absolutely. And, kind of going back to that, I know that you'll kind of see that a lot in bodybuilding athletes as well. Many coaches will pull sodium away from their clients. And in that process, they get depleted of electrolytes, and they start to have heart palpitations and things like that. Can you tell me how depleting sodium could possibly affect their magnesium as well?
Well, you have to remember that sodium, potassium, and magnesium kind of travel together, right? So they kind of act as a group. So when we're looking at electrolytes, we always want to look at all three of them. But mainstream medicine really only looks at sodium and potassium, because where sodium goes, potassium has to kind of flow. And so if you take away sodium, you're not going to have potassium in the same level. And potassium is what creates we need potassium for the heart. We need potassium for regular heart rhythm, regular heart rate, and all of those things. And then of course, if the sodium potassium ratio is screwed up, now you're going to screw up your magnesium ratio. And magnesium is also there to make sure we have regular rate and rhythm. And so when we have this disruption, this is where we see the irregular beats and the irregular rate and rhythm that you see with things like an arrhythmia or something like that. Yeah.
Gotcha. And kind of moving back into symptoms. I mean, there's so many symptoms, like you said, that magnesium can kind of fall into, also holding hands with other disorders and things. But what are some of the main things somebody that is depleted of magnesium could be seeing?
So we could have symptoms. I mean, if I were to just start from the top and go to the bottom, mood changes, anxiety, a lot of depression is an imbalance of magnesium and neurotransmitters. We could see headaches, tension, upper shoulder tension, neck tension. We could see heart palpitations. We could see irregular heartbeats. We can see hormonal imbalances because magnesium is responsible to regulate our hormones. We can see thyroid dysfunction. We need magnesium in the thyroid to create thyroid hormone. It helps to increase that. It helps the conversion of T4 to T3. So we could also see, like I said, any type of thyroid issue, joint pain, muscle pain, stress. Like we can see all of the physical ailments of stress, insomnia, sleep. Yeah, it's just, it goes on. Like there's just so much because it's involved in everything. I think the most important thing is, you know, we have this huge vitamin D deficiency. And when you look at what is required for vitamin D, we're always being told, oh, well, you know, we need the sun and we need active vitamin D. And that's all great. We do need that. But if you don't have enough magnesium in your system, you're not activating anything you're taking. So you're just taking vitamin D for nothing because it's not going to activate. And the big thing is, oh, well, I'm already taking vitamin D3, it's active. And I'm like, yes, that's an active molecule, but it has to be activated in the liver for your body to use it. And what do you need to activate it in the liver? You need magnesium. And so often when you see these vitamin D deficient individuals, they're very deficient in magnesium because they can't, that conversion isn't happening. And so, you know, they can take all the vitamin D they want. It's not gonna work for them. And then once we add in magnesium, we see their numbers start to go up again. So, yeah.
Awesome. So I want to reverse back a little bit to something that you said when you were talking about your patient, and that is blood work. So I've noticed in my own blood work, unless I was missing something, I should have gone before this podcast and gone back over it again and, you know, actually looked at it closer. They do test for magnesium, but I can't say that I've ever seen more than one test for it. Are there some certain tests you should be looking for on your blood work to make sure that your doctor is actually testing for the right levels?
Yeah, so most doctors will only test the straight magnesium test. And unfortunately, that isn't going to tell you much, if at all anything, because they're really only testing 1% of what's in your body. The rest of it is in our tissues and stuff. So we need to ask for an RBC serum magnesium test. And so it's testing it inside the red blood cell. And what they normally want to test is just the stuff that's in like your circulation, which unfortunately magnesium is not great. And so you'll always get a normal result because it's only testing 1%. So we want to make sure it's an RBC magnesium test, and that then tests kind of what's in the actual tissue, which is what we really want to know because that's where magnesium is active. So it's a really important distinction because if you're just looking at magnesium, you're thinking, oh, I'm okay. It says I'm okay, when you're really not. So, yeah.
And that's what I was thinking is I was pretty sure the last time I had my blood work done, it just was magnesium. There was nothing special about it. And it said I was within range, which who knows what that really means these days, because normal, you and I both know, is a number of the whole nation, which most of the nation is unhealthy at this point. I don't know how Canada looks. I know the US isn't great. So with that being said, normal can be a kind of skewed number these days. It shouldn't be normal. It should be optimal.
Right. And that's, I mean, they make these ranges so great because they have to include the general population, obviously. But, you know, you want to always be on either the center, the middle, or the higher end of what is considered normal when we're looking at magnesium status. So if you're just hovering around the lower end of the range, that's not optimal. We want to be like in the middle minimum, and then if not, towards the higher end of that range. And so, yeah, so these ranges are often quite large. And so they can kind of put a lot of people in between and, you know, you're healthy. So they say.
Right, exactly. And I see that in so many numbers, right? Where they're like, your thyroid is healthy, your hormones are healthy, this is healthy, that's healthy. And then you go back, now that I know so much more, and thank goodness I have spent a lot of time trying to make sure that I can achieve good health and seeing what I actually should know rather than what my doctor is telling me. Because that's another thing I find with people is they're like, well, my doctor said, well, what did they say? Do you really know what their reasoning is for that? Or if they actually know, or if it was just something that they were taught and maybe they don't actually know. I mean, we all have our own opinions on things, and it's unfortunate sometimes the opinions that they learned from or textbooks may not have been 100% accurate. So, and I understand it's very hard for you guys as providers to get correct information, and that's why you need a well-informed doctor that looks at all pieces of the puzzle and not just one little piece. So, anyway, going back to that, as far as the blood work goes, you want to definitely be looking for somebody that's putting you in optimal ranges, not whatever the within normal limits is.
Right, right. We definitely want to look at optimal ranges because that's where you're going to feel the best, right? So, I mean, even if we just take something like the thyroid, for instance, and I don't know what the ranges are in the States, but here it's like 0.5 to, we used to be at 5. They've brought it down to 4, thank goodness, because at 5, they still were thinking it was normal, which now you're like probably very hypothyroid. But now, there is 0.5 to 4. If you're at 3.5, that's not optimal, right? We want to be around the 1 range or the 1.5. That's an optimal range. You're feeling good when that is at that range. But like I said, because, and physicians are taught to, as long as it's within that limit, they can't really prescribe you things, or they can't say anything because you are part of the normal, ratio that fits into this category. So it is really important to, go out and seek out a healthcare practitioner that can look at your blood work and make sure that you are in optimal ranges in all of your stuff, because that's what's a lot of the times that's the problem. I mean, if you take somebody who is at the 4 range for a thyroid and you get them to a 1.5, they're going to feel 1,000 times better, right? So, and it's the same thing with any other blood work that you would get.
Yeah. And that's one thing I find. I know people say, well, my insurance company says I don't need this or that. And I'm not sure how it is up in Canada, but I know in the States or anywhere really, this is my opinion, but insurance companies are there to make money. They're not there to be your health advocate. So at one point, you have to take your health into consideration and find maybe a doctor or somebody that doesn't have interests vested in prescriptions and insurance and all of that stuff. So sometimes it's worth it to get out there. I know, especially for myself, getting into a more functional medical approach with my own health was what ended up saving me.
Yeah, for sure. And I mean, I agree with that 100%. I think that here we don't have insurance companies. We have a publicly funded healthcare system, but again, it's limited, right? So they're not going to want to order tests that they feel are not necessary, but then you could go to your naturopathic doctor and we can prescribe and requisition tests as well. So, what the mainstream doctors don't prescribe, we usually will requisition and test and make sure that it's good. Yeah.
I love that. I love that. So back to magnesium, if there was anything that you really wanted to get out there about it, what would it be?
I would definitely, have your levels checked, because it's always a good baseline for you to know where you're at. And then if you are working with a healthcare provider, they can definitely, depending upon what your symptoms are or what you might be experiencing, they can definitely figure out the best form for you. And then, of course, the best dose, because maybe I only need 200 and maybe you need 400, right? It's very dependent. Like, it's dependent upon your levels. It's dependent upon where you are, like in the life stage. It's dependent upon how much energy your body is expending every day. I mean, an athlete is going to be very different from somebody who sits in an office all day long and works at a desk, right? So they will be able to get that appropriate dose for you and make sure that it is the right form. But I do feel like we do have to supplement, unfortunately. We cannot get what we need from our food. I wish we could. And, I wish that we could get all that we need from our food, but that's just not a realistic end,
Right. And obviously, people need to speak to their own doctor about this or their own healthcare professional. But if there was a recommendation, I mean, I'm a huge fan of blood work. I have started having many of my clients get it just because they need to be aware of what is going on. But the thing is what do you as a healthcare professional recommend if somebody isn't getting it those levels measured because we are in such a magnesium deficient state? Is there an amount that you would recommend that somebody uses to supplement?
Yeah, so usually if that's the case, then the recommended dietary allowance amount is 310 to 400 milligrams per day. So I would probably start somewhere in that range if that was, if you were looking at doing something. Magnesium is a fairly safe supplement. There are some issues that need to be addressed if you have any type of kidney disease, because that's how we expel magnesium, obviously. So, if you have a kidney issue, then you definitely want to be working with a healthcare provider. And then, as far as taking it alongside whatever medications you're taking, you just want to make sure that you're not taking it at the same time so it's not interfering. But yeah, like other than that, it's a fairly safe mineral to take. If you experience a side effect, like I said, it could be loose stool, right? So that's kind of what I think you would be expecting.
Okay, awesome. It's kind of tricky because some things you can way overdo it and actually send yourself to the other side of the scale. And then some other things are benign and they'll just kind of show up, like you said, in the form of a loose stool. So it's good to know because with some things, what you don't measure, you can't manage. And so it's really best to be working with a healthcare professional on them.
Absolutely. Because I mean, they're going to be able to know what medications you're on, they're going to know what your symptoms are, and they're going to be able to get you on the right form and at the right time and at the right dose, which makes a big difference, right? So, I mean, if I said to you, go take 800 milligrams of magnesium, you might feel like you just can't get off the couch, which is not a good thing, right? We don't want that happening. So, yeah, it's definitely a good thing to work with a healthcare provider.
Now, circling back to something you said a while ago about brain health and depression and mood and things like that, are you seeing magnesium being added into treatment for people that are struggling with any of those things?
Yes. Yeah. So a lot of the concussion treatment plans, the traumatic brain injury plans, they all have magnesium added into their treatment plans. I, in 2018, had a aneurysm that burst in my carotid artery and had brain surgery. And so I used it. And yeah, like the amount of inflammation and the amount of swelling, like it just all, they were like, wow, like we don't really see what we're expecting to see. So it does do a lot. And I took it quite consistently and I took it at a fairly high dose, but it is a part of a lot of concussion treatment plans and traumatic brain injury plans for sure. Yeah.
I
Yeah.
love it.
Yeah.
So, did we miss anything here? Is there anything important that we need to let my listeners know that could help them as far as understanding magnesium goes?
Um, no, I think we've covered most of it. I think the most important part is A, see if you can get tested. B, if not, start maybe with the RDA amount, which we said, which was the 310 to 400 milligrams per day. And, maybe watch like some of your sugar intake, some of your carbohydrate intake, and just not get to the point where you are really depleted. And yeah, and just, I think everybody needs the supplement. I don't think we can get away from it.
I love that. And that's why I had you come chat about it and talk about all the different kinds and stuff because it is very overwhelming. I know the first time I walked into the health food store, I was like, what kind of magnesium should I get? And here I'm asking this person that works there, and they probably have no dietary knowledge. I mean, just from what they've been taught from working at the store. And it's like, okay, I don't know, like, how important this actually is. So, anyway, if there was one thing, it doesn't have to involve magnesium at all, but I ask this to all of my guests. If there was one thing that you could get out there that you want to share with the world, what would it be?
One thing. Um, well, I think it has to be with magnesium because it's a big part of my practice. I think the one thing I would do is probably get on a bisglycinate supplement. I think that it's just something that we need to get to optimal health and something that I think our body is starving for. Yeah.
Love it. Well, Barb, I am so thankful you came on and talked with us on the show. How will people get a hold of you if they want to find you and look at all your stuff?
Well, I can be found on Instagram at Dr. Barb Woegerer, which is just my first and last name. And that is where I post all of my magnesium stuff. Like I said earlier, about 80% of my account is all about magnesium. And we're just in the middle of hosting a magnesium form series on my page. So I don't know at the time of recording, this is what we're doing. So we're going through each of the forms and giving all of the research behind the different forms and stuff like that. Yeah.
Awesome. Well, I'll put all your information in the show notes. That way people can slide on into that note area and click on the links if they need to go and find you. And I certainly appreciate you coming on and chatting with me today.
Oh, it was my pleasure. Thank you so much.
Thank you.